Hello, everybody, and welcome to our Facebook Live. Oh my gosh, was that echo? No, we're good. Renewing your Apple Health coverage today with our team, and we'll have everybody go around and introduce themselves. We're still waiting for a few more people to join on, so hopefully I'll get them to introduce themselves when they get here. But my name is Mia McFarland. I'm with the Pacific Islander Health Board, and I will pass it to who I see next, Renza.
Hi everybody, my name is Ransa Milo. I'm with the PI Health Board and I'm working with the Chukis community.
All right, thank you. And then Diela.
Hello everyone, my name is Diala Owegi. I am with the PI Health Board and I am working with the Palauan community.
Thank you. Roz?
Half a day, I'm Leon Guerrero. My pronouns are she, her, and I'm with the Healthcare Authority.
All right, thank you. And then last but not least, Clara. Oh, you're on mute.
I always do that. Hi, I'm Clara Monfel. I'm from the island of Yap, and I help with Yapese community.
All right. Well, thank you. Thank you, and thank you to everybody who's joining tonight.
Hey, Mia, before
yeah.
we start, can I share something real quick?
Yeah.
So March is what we call Mes Chamorro. It's Chamorro Heritage Month. And the people from the Mariana Islands, that's Guam and the Northern Mariana Islands, Saipan, Tinian, and Rota, and Northern Islands celebrate this month. It's proclaimed Mes Chamorro, and it's to educate and continue to instill our culture, language, and traditions. So I wanted to share a little with you all. And if you see a chamorro from Guam or from the Northern Mariana Islands, again, the islands of Saipan, Tinian, and Rota, share the Hafa spirit. Say Hafa Day.
Okay.
Aww. Well, then, happy day, everybody. Welcome to the live and happy Cultural Month. That's very exciting. Oh my gosh. We're getting so close to the summer season, which is my favorite because it gets into like the API Heritage Month and all the NHPI celebrations for our community. All right. And then Alinda, can you hear us?
Yeah, can you guys hear me?
Yeah.
Aloha. Rananim. Tomorrow I forgot of a day. Okay. See me.
Do you want to introduce yourself, Alinda?
Okay, sure. My name is Alinda Alik, and I'm from Marshall Islands. And there's this tiny island that it's called Millie. That's where my mom is from. And you should all go there. It's really, there's no mountain, there's no river. There's a lot of fish and coconuts and breadfruit. But yeah, I'm working with the Marshallese community, and I love working with all these culture like Yapis, Chamorro, Samoan American, uh, Palau, Chuk, Panepe. Yeah, and thank you so much. So I am a COFA elf navigator also and a community navigator. Thank you.
Thank you. All right. So welcome everybody to the Facebook Live. Did that share? My computer's freezing. Oh, there we go. Can everybody see the slides? I should double check. We're good? All right. So welcome to renewing your Apple Health coverage to everybody. Before we get started, we'll obviously be doing trivia like we've been doing the last couple of times. So today's trivia is based on our last presentation, how to approach problems with your coverage. So go ahead and comment your answer for a chance to win a special prize. The first person that answers correctly wins. And today's special prize is Target gift cards, which if you've ever been to Target, crazy place. You'll spend a lot of money there. But this will be something that helps pay for all that, all the excess shopping. that you do. Okay. All right. So question 1 is, who should you call if you receive a medical bill? And we'll give it a little time. Oh. Yeah. All right. Let's see any answers. Oh, hi, Alana. I'm glad you could join. All right. While we're waiting, does anybody have any good reminders for this month or anything, any other holidays or things coming up? Actually, I should say, yeah, Alana won't answer the question. PIHB is going to be opening up our office soon, so keep an eye out for a flyer for what hours you can stop by and join in. All right, we'll wait for more answers to roll in. Anybody? Alana, you can guess if you would like.
Do we need to add a fuller scenario? Like somebody already has Apple Health and they get a bill?
Yeah, that makes sense. Yeah. So like if you have Apple Health, and we talked about this last time, that if you're covered in Apple Health and you go to a provider that accepts Apple Health, you shouldn't receive a bill. So if you do receive a bill, who should you call? Any guesses? Was this too hard? Oh. Okay, I do see the right answer. We'll give it time. So this is the right answer. Your insurance. So there was, based on what we talked about last time, there's, oh, here we go. This is there's a community member answering. Yeah. So you'll win the prize. Alana, you win kudos for knowing. So there's a couple places you should call. So your first step would be to call the hospital or provider that you went to and double check that they billed your insurance. If they did bill your insurance and they said everything was good, that's their first step. That I know Roz brought that up last time, was that should be your first step. And the next step would be, if you receive a bill, call your managed care plan and let them know that you received a bill. And then you can also contact HCA at 1-800-562-3022. All right. Get this thing to move. There we go. All right, question 2. Who should you call if you don't receive or lose your managed care card from your managed care plan? This is a big one because we go over it all the time, and it's on our website. Leave some time for guesses. Guesses. We'll give it one more minute for a guess. And I know there's 9 people watching, so if any of those 9 people have a guess. Anybody? Well, while we're here, does somebody on our team know the answer? Oh, we have one guest. But does anybody on our team know the answer? Someone guessed Apple Health. Not exactly. No. Melinda, I definitely know you know the answer.
I'm not sure. Is it the navigators?
No, you sent this this information to us.
Oh, okay. Okay, you should call your plan, your Apple Health Managed plan.
Yeah, that's the one.
Okay, sorry.
I know. I was like, it seems like a trick question because it says managed care plan like 2 times in here. But yeah, that's right. So nobody wins this gift card. I guess we'll save it for next time. But yeah, so you should call your managed care plan. And here's the phone numbers for all of them. So AmeriGroup, Community Health Plan of Washington, Coordinated Care, Molina Healthcare, and United Healthcare Community Plan. So you would give them a call and let them know that you either didn't receive the card and it's been about a month or more that you haven't received the card ever, or if you lost it, go ahead and call them. Oh yeah, see, Clara, you answered correctly in the comments. You were right on it. Yeah, so you should call your managed care plan and let them know that you need a replacement. All right, so that's the end of trivia for today. We'll do trivia again next time. Please, this is a quick presentation. I know it is, so if everybody pays attention, and you'll know the answer for next time. And you could win, we'll probably do gift cards again, so you could win another gift card. All right. At this point, I'm going to pass it to Diella.
Thanks, Mia. So our agenda today includes going over 1095 form information for taxes, how to update information on the WA Health Plan Finder. We'll also be going over when to renew, how to renew, and what to do if you're renewing late. And lastly, we'll finish up with a brief talk story with the team and can answer any questions raised from our presentation today. What are tax credits? Tax credits, also known as advanced premium tax credits, are an amount paid to your plan that helps keep your insurance affordable. Tax filing. Wait to file your taxes until you have your 1095-A form. Washington Health Plan Finder mails the form to you at the beginning of the year. When you get tax credits, you cannot file your taxes without the information from the 1095-A form. Use the information on the 1095-A to complete IRS Form 8962 and attach it to your IRS Form 1040. 1095-A replacement resources can be found online at wahealthplanfinder.org or by phone at 1-855-923-4633. For additional tax filing resources, you can contact the Volunteer Income Tax Assistance Program at 1-800-906-9887. You can also contact the CLEAR hotline at 1-888-201-1014, or you can file for free online at irs.gov.
Is that my Sorry. How do I update my information? Contact information is not up to date. Log into your wellhealthplanfinder.org account. Go to your dashboard and select Report a Change. Select the change you want to report on the Report Changes screen. That's how it's going to look on the screen. Then you can go to Report Changes. When to renew. When you get approved for Apple Health and it's time to renew, W Health Plan Finder send you a letter to remind you to renew your Apple Health coverage. It's important that you keep your mailing address updated. The letter may say that you will be automatically renewed. Be sure to confirm the information in your application is up to date.
And this is the example of the letter, and this is how it looks like. And it depends on what it says, how to that you need to renew your insurance. Okay, how to renew Apple Health Medicaid. Apply for or renew your Apple Health coverage online through Washington Health Plan Finder if you are an adult age 18 to 64 years old, applying for children, a parent or a caretaker applying with children, pregnant or applying for someone who is pregnant. You have several options to apply for or renew coverage. Going online, go to Washington Health Plan Finder, select the Apply Now button. For mobile app, download the WAP Plan Finder app, select Sign In or create an account. And for phone, call the Washington Health Plan Finder Customer Service Center at 1-855-923-4633. For paper, submit an application for health care coverage, form number 18-001P, in person with a PIHP navigator.
Thank you. Um, how to renew classic Apple L as Medicaid. Apple, sorry. Apply for Apple L Classic Medicaid coverage online through Washington Connection if you are an adult age 65 or older, blind or disabled, or need long-term services and supports. You have several options to apply for or renew Classic Medicaid coverage. Through online, you should go to Washington Connections and select Apply Now. You can also apply through or on an application for age and blind, disabled, and long-term care coverage, and also on phone as a request an application by calling that number 1-877-501-2233, and also go in person. As you go in person, you can go to one of our local Department of Social and Health Services DHHS office. And for age, blind, and disabled coverage, go to THH's Community Services Office. And for long-term services and supports, Home and Community Services Office. Are you guys there? I'm sorry, it's the connection. Can you hear me?
Yeah, it's still you.
And it's if it's late to renew, what are you going to miss is the deadline to renew, right? And then you will like to continue your coverage. You will please contact the Washington Healthcare Authority as soon as possible. If they find you eligible within 90 days after the date you lost your coverage, they will cover you for a period you were without coverage. And the number is provided here, and you can call 1-800-562-3022. To renew within 90 days of lost coverage, go to https www.washingtonhealth.gov wahealthplanfinder.org, or you can call 1-877-923-4633. Thank you.
All right, I'm gonna bring every but the computer wants to freeze. Friends, are you able to add people to the stream?
No, it said remove. Who's not on there?
We're still missing. There we go. All right, there's the team. Okay.
Now we see Alinda.
Yeah.
Oh, there she is.
The laptop
Okay.
is
So for this next portion, that's about it for the information section. We're gonna go into Q&A right after this. So if you have any questions, please put those in the chat. In the meantime, we're gonna just have a little talk story tonight to get to know the team. And so for our team, I've got a question here. What has your experience been like with your own Apple Health coverage or helping others with their coverage? I don't want to pick on you, but I will.
Alinda, you're.
Okay, I'll go first or what?
Yeah, sure.
That's supposed to be going first. It was supposed to be Renza. But yeah, well, with there was one elderly, and she went to the ER, got admitted there for COVID, and she was unable to like cover her bill. So I had to help her, and then she was really happy, so happy that she cried. But when she got out, she needed so many tools for her to, like wheelchair and something to check her temperature, and also her I forgot, high blood pressure. Yeah, and yeah, something like that. And also for her to exercise inside her house, she needed stroller and what is it? Yeah, wheelchair. So we had to look for her plan, and we found out that Molina plan is providing those for elderlies free. So that's one thing that I learned about, and it's really good for these elderlies to know what is the number, and someone in their house can help. And also the other one is about dental. Some of the elderlies were calling and complaining about the how come they cannot go and see their doctors. So I told them to look at their card in the bag, and if they don't have that card, just call the number for their health plan card that I share. So that's what I experienced. I I wish I share more, but yeah, that's what I experienced. So I hope you learned something.
Wait, who's next? Clara.
Oh, well, I guess I think I've shared this before, but I'll just go ahead and share it again. My experience with when I first came to the state, I needed medical assistant. I didn't have any insurance. I applied for Apple Health, only later to find out that I was not eligible for that. And then my sister told me about COFA. I finally got enrolled in COFA. Then along the way, I don't know what happened, but I received a letter from Apple Health that I'm qualified for Apple Health. Then, but my health plan somehow I don't know, but they deduct 600 plus money from my bank account. And that's when I start calling. I didn't know who to call. I called Apple Health. They gave me another number. I called Kofa. I didn't know who I was talking to. It went on and on and on. But I finally got my money, and it's always been in my heart that how I can, what I went through. I didn't know who to talk to. So that's my experience now that I'm really happy that I'm part of this team, that we can reach out to, we can help our community, and I'm so happy to help my community or whoever, and that they won't go through what I went through. So I'm so glad, I'm so happy for this office and this. Also remember that our number is 1-888-308-7113 if you need help. Thank you.
I'm so glad you have the number memorized. That's awesome. All right, Renzer Diala.
Oh,
I'm sorry, I wasn't prepared to share today.
Okay.
okay.
Well, like,
Oh,
oh yeah, go ahead.
oh, I was just gonna say, I think one of the ways I personally benefit from Apple Health is gaining the access to mental health resources. I similar to Clara, I never thought I'd be able to afford therapy or counseling, especially as a first gen COFA student. But Apple Health has made it more accessible. And I do think that finally having access to what I needed felt like this huge weight off my shoulders. And as a navigator, what I get most from community members is that feeling of relief that like they're able to be heard and to have their questions answered. So I'm really thankful, Clara, that you shared that because I resonate 100%.
That's awesome. Yeah, I think one very exciting thing about doing this work is having our community members being able to be trained and go out and talk to community about all the work that we're doing. That's been really exciting because I know like the team at HCA is Ariel and Roz, and like this is a pretty big state with a lot of Kofa Islanders, and so being able to assist in the work that they've begun, like it's very, very awesome, and I think accessible to our communities. But Renzo, I think what's been a highlight for your community? Because I know you've been enrolling all the time.
Well, yeah, maybe I'll share that. People, people that I've been helping them enroll, they've been, relieved that they don't have to go to waiting on the phone, or like they don't know what a website to go on. So I'm so glad, I'm grateful that I can help people in my community, and they thankful that you know there's someone that they can ask for help when it comes to the health Apple Health insurance.
I like it. All right. Any final thoughts there, team?
Yeah, I have something to add up. Regarding the plan, it's not only Molina that have benefits, but also a community health plan of Washington can offer car seat, and also Amiri Group have some for elderlies, like a lot of benefits for it. And yeah, the other ones, and we need to check them and also share it with the community because it really helps. We were like talking about dental a lot in the community, but they were complaining that about like the limited services like crowns and other like other services in the dental that is limited. And I was explaining to them that yeah, even though like it's limited, but at least we can clean our teeth, and get fluoride pulling teeth extraction, right? And the other services, and dental is really expensive, and that's what we need to know. We need to be happy of what we're getting, and Apple L is really good for us like all these COVA nationality. I think we're really benefit from it, and I want to thank Washington, Roz, and April for helping us too, and all their team of Washington Healthcare Authority, because and whoever like help us along the way to get this. It is important to be appreciate of all these needs because insurance is really expensive. Think about all these elder; they are getting free
Yeah.
services now, and get their taking access to preventative services and get well, and PLD. That's it. Thank you.
Yeah. Thank you. Thank you for bringing that up, Belinda, because I know we went over this a little bit last time, but you were mentioning the additional benefits that plans have. And so they call them value added benefits of the managed care plans. We have this on our website right now, the value added benefits of each of the plans that as current as I know. So all of them are there, like Molina, United, all five of them. That's on our website at pahealthboard.org/COFA Islander outreach information. 1,000,000 dashes. And then you can even download the PDF and take a look. And we'll have this out. I know we're moving to in-person events. We'll have this copy with us when we go out to educational events and enrollment events so that people can see what's available, and hopefully help them make a more informed choice.
Yeah, and we can also translate them. Like our navigator, we're willing to translate them. So those who need to understand it, that we don't know English well, and we can help them too.
Yeah, I know it's done in Marshallese. Carlinda was able to translate it, but the rest of the languages, you're right, need to be translated. All right. And then the last bit on this is we have our survey. So if you can take our survey and let us know how we're doing, I posted the link into the Facebook and the YouTube so that people can take a look. Wow, too far. Oh, hi, Carlinda. She's here. Yeah, so Carlinda translated into Marshallese. I went too far.
Linda.
Yeah. Yeah, so we have a copy of that. All right. But yeah, so if everybody can take the survey, let us know how we're doing. We'll get that posted. All right. Now we have time for questions. So if there's any questions from the community, please pop those in the comments and we'll go ahead and answer those while we're here.
Hey Mia.
Yeah.
I just wanted to chime in a bit. So one, we have to give thanks to the COFA leaders out in the community who really advocated for the COFA Islander programs. Leaders like David Anatok, Gigi Jolly. There are a bunch of folks out there that really went out and advocated really hard, partnered with agencies that helped supported them and advocated for them. And HCA has been, doing their best. We've been doing our best to support the COFA communities. This is a really great program. Too, like how Clara mentioned, she had some difficulties. I think folks need to remember when you apply for health coverage, right, or healthcare, you receive an eligibility letter and you must act on it, right? So if you are eligible for COFA, for the COFA like healthcare, COFA Islander Health or COFA Islander Dental, they do give you time to select a plan. And it does not start until you select a plan. And so some folks often would select them afterwards. And like we try our best to get coverage for members, COFA members, as soon as possible, like when they apply. We try to help folks, and it's we really try to do what the COFA leaders have done, advocate for healthcare, and we just try to ensure that there's coverage, if they are eligible for the programs. Two, I think you all forgot that you all are PIB navigators and that folks can call you to renew, can call you to apply, can call you to renew. You gave the numbers for the Healthcare Authority Customer Service Center and to the Washington Health Plan Finder. But the one thing that you all can do, in future education events, when to apply, to renew, to report changes, they can contact you. You have that access to help our Kofa Islanders out there. Um, Anything, update addresses to like report changes, update addresses, new jobs, loss of jobs, like anything, they can call you. That is why we have navigators such as you all. Pregnancy, you have a new baby, any changes, um they can call you. And I think you all should give yourself that, like, go out there and advertise that you can do it. You can help our Kofa Islanders out there. You do the outreach, and you can also do the support. So you all are doing a great job. Ari and I, we're here to support you all. If you have any questions, come to us. And for folks out there who are tuning in, our navigators, you heard it. They have experience. They have Apple Health coverage. They have experience, so they understand the challenges and the barriers that you all have. With health equity. But they're here to support you, and they're here to share the experience with you. Just remember, it's not just about health coverage. It's also other benefits: dental, hearing aids, vision, transportation services. These are just a few of what our Kofa Islanders need out there, or Pacific Islander communities, to know and to learn about Apple Health. So yeah, Mia, post this up. I'm happy to hear that these are being translated in the Kofa languages, because this is what we need. This is why we're here. I'm pretty excited. I always get excited for events like these, because because of COVID, we're unable to go out and do in person as much as we can, but through social media, this is something that we can do, and we've been doing this since we learned about the transition or the restoration of Medicaid for Kofa Islanders. That is our goal. This right here, the outreach to our Kofa Islanders. So yes, advertise away, folks, because our team, because and you all should pat yourself on the back, because the outreach that you all are doing, this is something that we have been working for. So Ari, do you wanna add something?
No, you covered it. I do have one question for the PI Health Board team, though. Is how do people get in touch with you if they want you to come to their event or church or softball game to talk about Apple Health and enrollment?
Oh, great question. So I know that people will generally get in contact with the navigators one-on-one, like through Facebook Messenger. But so there's a couple ways to get in contact with us, though. I posted up, thank you, Roz, for the reminder. I posted up everybody's contact information. So all of our emails, phone number, we all have the same phone number, obviously, because we work for the health board. You can get in contact through us, the website, pihealthboard.org. I think on the main page, there's a contact. You can go to our Facebook page. Take a second and load that one day. But you can go on our Facebook page and message us there. We're PI Health Board on Facebook also, yeah, /PIHBWA. You message us there. And now you can come to our office, really, if you want to do that as well. That is not loading. But yeah, there's a couple ways: Facebook, Instagram. Oh yeah, Esther agrees with Facebook Messenger. People message us there all the time. give us a call. If you just send me an email. That's how we got invited. We were at Pika's event over the weekend at their wellness fair, and I got an email from Brenda who said, "Hey, can you come on down to this event?" And so we did. But we're open to going anywhere. We'll be doing an event in Spokane in May, and then the Lacey Polyfest in June, and then the Pacifica Food Festival in August. So wherever we can come, we'll make it out there. Yeah, that's not loading. But I honestly, if you're on this live, you know where to find our Facebook.
So does that include making trips to Longview? Going down south to Longview or Tri-Cities?
Yeah, so that was, we did, during open enrollment, we did, I think we went to 6 counties. So we were out in Spokane County, we were out in the Tri-Cities, in Vancouver, Washington, all sorts of places. And we went up to Skagit County, which we weren't originally going to go to, but the church leader there requested that we went up there. So we made an event just to go up there and enroll folks and meet the community there and answer questions and do vaccinations. So we're able to go up there too. And we're going to go out to Longview, down in Cowlitz County. We'll be back in the Tri-Cities again, all sorts of places. But let us know if there's places you want us to be, like that we're missing, or you're wondering if we're going to be there, because we're going to go out to all the counties again and make sure we get out there and see everybody.
And one more place I'm thinking about is Auburn. I know Auburn is close to your office, but I don't know if you'd make a special trip there if somebody asked.
Yeah, Alinda, do you want to take that one?
Okay, what's the question again? Sorry.
Yeah, like what about, like, what are we up to in Auburn?
Yeah, we have churches that have invited us, and we just have to find out when. And we're gonna, because summer is coming, we're gonna have to also communicate with the president or Seattle, Washington, Marshallese, and also the other churches and all that. I think that's good. So if we go to the Blaze, the sport game, I think we'll enroll more and more, and even the churches, because that's where people go to. But we've been invited so far to all the churches.
Yeah, especially in Auburn.
Yes, there's 6 churches that are ready for us.
That's so
We gotta get
exciting.
on it. We gotta get on it. Yeah.
I know.
That's right, because you're right, Ariel. There's so many avenues to reach community, and we're open to meeting with all of them. I know we've been connecting intentionally with churches and our community associations so we can meet community. Okay, we did have one question. Maybe it'll load here. All right, is there a limit to renewing Apple Health applications? So say I experience multiple situations in a month, like job income changes, loss of health coverage, and finding out a pregnancy. Would I need to renew every time there's a change? So you wouldn't, unless it's time for you to renew, you should make those updates immediately. But I think it's within that month. Is that right, Ariel and Roz, that you should make some of these updates?
Yeah, so a couple of them, you would want to report when you lose your health coverage, or you find out you're pregnant, or somebody in your household is pregnant. You'd want to report that right away. For income changes, it's a little bit different. There's a rule there, so we want to make sure that when you tell us about a new income source, that it's one that's going to last, that you think will last at least 60 days. So if you just got hired and you think your job is going to last into the future, go ahead and report it. You do have 30 days to report income changes. But that's the one little change there, or the one difference between income changes and healthcare or pregnancy. And then, so I think Mia really hit on it, that there's a difference in reporting changes versus renewing your coverage. So that is on a kind of separate timeline. Roz?
Right, because you get that renewal information. They'll let you know when it's time to renew versus like you can make changes at any time depending on if something in your situation changes, like Ariel was saying. Oh man, any more questions?
I have a question from my cell phone messenger.
Sure.
Okay, this one is from Gigi Takaya. Gigi, if you're watching, okay, get ready. Okay. What about those that owe Molina $2,000 and plus while on COFA Medical? What can they do with their bill?
That doesn't really make sense to me, because if somebody was on COFA, they should not owe Molina. So I would suggest, if somebody still has questions about their COFA Islander healthcare coverage and think that a bill should be covered, they should contact our COFA questions, either email box or phone number. And Roz, can you let them know that info?
Yes, our email address is COFA, COFA, questions. It's one word, questions, QUESTIONS at hca.wa.gov. Do you want to put that in the chat, Mia? And our number is 1-800-547-3109.
Oh,
Could you repeat the number again?
And Alinda, just the same process that you do when you would send it to the COFA inbox. You could send that information to the COFA inbox.
okay.
The number is 1-800-547-3109.
Okay. Thank you. There's another question. This is from the Vice President of Oregon, Marshallese Community. Easier. So there's a lot of people that have difficulty applying. They don't know how to go online. They don't have the access and they don't have phone. And it's very difficult for them to know. Is there any way we can make it really easy for them to apply on paper? We can distribute around. Is that okay? Or what do you think about that?
For the Oregon community?
For anybody that is on insurance, having difficulty because they cannot go online or they have difficult with write, or is there any can we do that, like distribute paper application? Is that okay? Is that, I don't know. Yeah.
They can do paper applications, or if they're in Washington, because I know you said it was an Oregon leader. If they're in Washington, they can
Easier.
give us a call. And then I know Claire said the number 1-888-308-7113. That'll get a hold of our navigators. I don't know about the Oregon community, unfortunately.
Okay. Thank you.
That's correct, Linda. Think as a navigator, how would you reach out to COFA Islanders wanting to enroll in healthcare? And I wanted to go
Okay.
back to the question that you had asked. So So just remember, when you apply, when a Kofa Islander applies for the Kofa Islander programs, or even for Apple Health, right? There are eligibility requirements, right? So like income limit, like income and household, So a person could have been enrolled in a 2HP, but may not have been eligible for the Kofa Islander program, like Kofa Islander Health or Kofa Islander Dental. But we may want to check with the person you are working with to see if they were eligible.
Okay. There's a question they sent it. Thank you.
Thank you.
Awesome. All right, and then one more in the chat here. So how can I renew my Apple Health insurance? We'll go back.
You can call a PIB navigator.
Yeah, really, really the easiest way. The easiest way. So you'll know this is where we'll go. You'll know it's time to renew when you get this letter, and this is something it'll say, like it can say that it was renewed automatically, or it can say like additional information is needed to renew. So then you can go online and do it at www.wahealthplanfinder.org, or you can call one of our navigators. And that contact information, if my computer is right here. So all these folks can help you renew your coverage. So we've got Renza, Alinda, Diela, Clara, and then we can get a hold of the Costa Rican and Pompeian interpreters also at this phone number. Or you can also call me, but I will send you to a navigator. And so that's the team that can help you renew.
I will
All
say,
right.
so just one thing for people that use smartphones and feel like that's the way to go, that they're always just using a mobile app. Health Plan Finder does have a mobile app that you can do a lot of these things. It's just one option there.
Yeah, that's true. You'd search for the WA Plan Finder app.
Yep. And the other thing I'll plug is you can sign up for email notification. So instead of getting a letter sent to your home, you can, the folks here on the live here can help you set up getting email notifications. So instead of getting mail sent to your home, you can sign up and get an email, and it'll say, go read this letter. And it's more immediate. You don't have to wait for the letter to come to your house. And that's another way. If I know not everybody likes email or is online, but I just wanted to throw that out there as another option.
Awesome. Thank you. Yeah, that's true. There are a lot of options. Okay. Oh, too far again. All right. Any more questions from the crowd?
I think there's one left. It just came in.
Yeah.
Similar question.
Thank you. My computer's slow.
Okay.
I see that. All right. So it says, when's the insurance expire? It's a complicated question. So generally, for most of Apple Health programs, it'll last a year. I think there's other cases where you have to renew more frequently, depending on the program. But yeah, Renza, like you generally renew every year, right? or it automatically renews for you?
It automatically renewed for me, but in some case, if they need, any update from you, then they will send you a letter and let you know that it's time for you to renew.
It's true. Check your mail.
Yeah.
Open the
Really,
letters that they send
yeah,
you.
that's the key. Like when you get a paper from the health insurance, you have to open it and read it. Or if you don't understand it, call one of us so we can help.
Can we also like go in the system and find out the renewal date? Is that okay to look it up? Okay.
Yeah. All good. All right. I think that's it for questions.
I have one
Unless-
question coming in.
Okay.
Oh, I think we answered it, but they said they really want to understand where they can get 1095A copies.
Oh, yes. Let's go back. I know it's tax season, so we're going to have this on the next live too. Gotta be an easier way to do this. Bear with me. Okay, so you can go online, wahealthplanfinder.org, and log into your account to get it. You can call their phone number, 1-855-923-4633, and that's the Washington Health Plan Finder number. Or you can call one of our navigators. I know, Alinda, you've been helping people do that, right?
Yes.
Great. So there's a couple options there.
But can you explain that 8962? Like, I think Roz explained it last time, but they're asking again.
962.
Yes, that's the
8962. Gotcha.
8962 that you attach to your IRS form 1040. So the information on the 1095A is what you use to complete the IRS form 8962 that is attached to your IRS form 1040.
Thank you.
Yeah. And if you need help filling that out, there's the free tax filing resources we have on here. So volunteer income tax assistance is at 1-800-906-9887. It's a clear hotline, 1-888-201-1014, or you can go on the irs.gov website and look at their free file resources there. And then also locally, I know United Way helps file taxes. I know we've said this before, like we can't give a whole lot of advice, but if you're unsure about this and like you have your 1095A and you need help, I would use those resources. But if you need help getting the 1095, we can help with that. That's the one. Awesome. Okay. So I think we're out of questions, unless this question, I think, was about the taxes from Caius. Maybe if you want to clarify. But in the meantime, we'll just keep chugging on. So tune into our future events on Facebook Live or YouTube. And by future, I mean our last one, which will be Qualified Health Plans and Kofa Islander programs. So we've been through what's Apple Health, you qualify for Apple Health, what's next, how to approach problems. Today we did renewing coverage, and then we'll finish up the Facebook Live series with qualified health plans and Kofa Islander programs. And you can always watch the previous ones on our Facebook and YouTube. And then the next time we talk, we'll be announcing more about our in-person events also. And so check out our Facebook for that calendar and making sure that you stay up to date with where we'll be and where you can get help. All right. I think that's all I've got. Any last thoughts, team? No?
Remember, March is Viva Mes. It's Mes Tomorrow. It's Tomorrow Heritage Month. So when you see it tomorrow, say half a day.
Okay. Is there any event that we can go to celebrate?
I do not know of any upcoming events, but if I do know, I will share it with you, Alinda. I'll share it with you all.
Okay.
Or saying half a day to you, Ron.
Half a day. Excuse me, And VICs are less live.
No.
Oh, really? Thank you all.
We got one more, April 7th.
We'll miss you all.
Oh my gosh. All right. That reminds me. Thank you, Roz, for popping that in the chat. We are also looking for translators, interpreters. If you go on our website, pihealthboard.org, you can click the We're Hiring tab and look at our current job listings. Is this not going to load either? It worked. So we're looking for translator, interpreters. If you know anybody's interested, and you can give us a call. I think I'm actually the contact on here. I am. So you can send the resume to us, or you can give us a call if you need help applying. We're always here to help apply also. All right. Awesome. All right. Thank you, everybody, for joining in. We'll see you on April 7th.
Bye. Thank you all.